Proanatomy is planning for some live sessions regarding osteology and further topics on anatomy. So to begin with, after the request from some of the subscribers, we have decided to start with some of the basics in osteology. So the first thing we will be discussing about what are the types of bones and how they are categorized on the basis of their shape, structure and all. So that is the easy way to understand the bones. Before diving deep into the aspects of external features of the bone, you should know what are the basic shapes and how they are categorized. So let's begin with that. To start with, I'll take you with an example of a very simple bone that commonly we can identify without much difficulty. So here we have a triangular piece of bone that is nothing but the scapula, the shoulder blade, as you know. So this bone over here, you can see that it is a flat bone which will be placed posterolaterally on the human body. And similarly, if I take another bone, for example here, this is the femur bone, where you can see it is a typical long bone consisting of an upper end, shaft and the lower end, and making it typical long bone which is vertically placed in the body. So you might be thinking why I'm telling that it is vertically placed. It is because there are certain other bones which are also long bones but not placed vertically in the body. I can quote you an example here. So this is an example for a long bone which is not placed vertically. Instead, it is placed horizontally in the body. So this S-shaped bone which I am holding here is this clavicle, and you can see it will be horizontally placed like this in the body and exactly over your collar. So this is the example for a long bone that is kept horizontally in the body apart from the axis. And we have some other bones also. For example, here this is the sacrum bone, and you can see that it is not having a definite shape. You can't define it with words. So in such cases, what you are supposed to do is you have to consider this as an irregular bone, and you have to focus upon the external features and explain it further. Another example here is the skull, where you can see many flat bones combined together in sutures. So if you observe closely on this aspect, you can see the margins. These are the sutural joints which keeps the flat bones together. For example, for instance, I can show you how it is placed. It is almost like this, like the fingers getting crossed with each other. The sutural bonds are getting connected together to form the sutures. And another example for an irregular bone is the vertebrae, and you can clearly see the irregularity. We can't define it in simple words. Instead, we go for the details of individual parts of this vertebrae and start explaining it. So, hi for everyone. Again, some of them, in between you can ask the doubts regarding the osteology in the matter of the types of bones, so that I can answer the questions here. And another example I've kept here is the patella bone. So here you can see it is also a flat bone which is irregular in shape, but still you can make out the structure here. It is apex is facing downwards and the base here. This is how it will be anatomically placed in your body. Another example I can quote is a long bone. I hope you can identify it. This one over here is the fibula bone with an upper end, shaft and the lower end. So coming back to the different types of bones, to begin with, we have the long bones. This is the typical long bone with an upper end, shaft and lower end. So this is the common things about almost all the long bones. But when it is placed horizontally, things are different. As I told you earlier, as in the case of the clavicle, it is placed horizontally in the body. So there will be a medial end and a lateral end. But while explaining the long other flat bones, you can see here they are flat, and that is why they are got the flat bones. But in case of the skull, you won't be able to separately see them. Instead, they are attached together to form the cranial vault, which gives space for the brain to occupy. That is inside it, it's called as the cranial cavity or the cranial vault. So I have a question here, how to check the strength of the bones? So and that's a quite interesting question. When it comes to the strength of the bones, there are many aspects to look after it. So one thing, in the living body, to check the strength of the bone, the easiest way to check for the density and the calcium levels. So if the density of the bone has to be checked, we have some bone mineral density checking mechanisms, like we have certain BMD machines to analyze the density of the bone, to analyze the strength of it. That is the easiest way. So I hope you got the answer for that. And is there any other questions? If not, I can go in detail to the long bones. We will have a very short briefing about the long bones and their typical characters, if it is okay with you all. So here we have a long bone. I'm taking the femur as an example here. So here in this case, we can differentiate the long bones into three components mainly. The upper part is the upper end, then the shaft connecting it to the lower end. So I got another doubt here regarding a ligament tear, I guess. So let me describe what is the basic ligaments are. So when we consider the ligaments, the two bones are joined together by the ligaments. So the ligament tears are quite common in high intensity sports and athletes, and when they come across a sudden spontaneous extreme pressure coming over that ligaments can tear it, and that's quite common injury that happens. So I'm sticking on to the topic here. So we will discuss what are the type of long bones and what are the typical characters here. So started with upper end, shaft and the lower end. So when we look at the features, here you can see the upper end of femur is actually getting connected to that of the, or articulating with the hip bone, making the hip joint, while the lower end makes the knee joint possible. So the knee joint is one of the commonest joints which come across with ligament injuries. So the doubt is quite applicable here when it comes to the knee joint. There are 11 ligaments supporting the knee joint. So once we finish learning about the bones, exactly after that, we will go for the ligaments and joints and their articulations. So meanwhile, explaining the types of bones, I've told you about the flat bones. So we will be thinking about a flat structure. So here we have a very different flat bone here. This is a rib, which is a part of the rib cage. So you can see it is flattened from each sides, and it is just circling around to form the rib cage. So this is an example for a flat bone, apart from the typical flat bones. And I can show you another example for an irregular bone that is over here. It is a little hard to identify it. So this one over here is the heel bone, which is called as the calcaneum. It is one of the tarsal bones of the lower limb. So that gives a basic idea about the long bones, flat bones and the irregular bones. Apart from these bones, we have some small bones which are placed in the wrist region, that is the carpal bones. The carpal bones, they are short bones, and peculiarly they are all cuboidal in shape. So the cuboidal shape bones, they have a peculiarity that they can slide over each other, making the wrist joint movement easily possible. So these are the basic things you should know about the types of bones. In the further live sessions, we'll be going deep into the osteology aspects, where we'll see what are each bones and their external features, along with how they are categorized and how the muscle attachments are happening in them, and how to determine the site of the bones. So all these aspects will be discussed in the upcoming live sessions. And meanwhile, if you have any doubts or queries regarding any topics in anatomy, you can post them as comments and I'll be answering them in the live sessions. Thank you all for being here, and we will see you soon. Thank you.